Right now we have to admit that the classification systems available right now and the prognostication systems as well are on the way to implement molecular findings in MDS in any kind of treatment decisions. But from the clinical practice we already realize that the need for this information is increasing quickly. And that means that for patients with MDS in younger ages that also would be able to receive a bone marrow transplantation, for example, or to avoid over-treating those patients, or to decide about watch and wait versus starting with the treatment at some time point, not only dependent on the hemoglobin level and the anemia, for example. We realize that much better than chromosome banding analysis that we use since 50 years now in MDS, the molecular background as studied by NGS on gene panels is much more helpful for those patients. So I think in the very near future there will be no patient that we really can tell about his diagnosis and tell about the best treatment strategies in MDS without having on our tables also the information from the molecular level and from NGS panels for this respective patients. And I also foresee that this is not only important with respect to being mutated or not, but we have to have a look on the variant allele frequency. That means how many of these cells bear this mutation or not. Because we see a lot of pre-MDS diseases right now. CHIP is the very early one. We see ICOS, we see CICUS, we see patients that evolve very slowly or never to a real MDS, and we see on the other side patients that evolve from MDS to AML. And this continuum between a very low level variant allele frequency level of a mutation that we find, that we pick up in a patient, let's say with a very mild anemia, to a patient that finally has a clear MDS with respect to the bone marrow findings, and then to a patient that evolves into an AML that is mostly driven by chromosomes and especially by molecular genetic changes. And so without this information, we will not be state of the art to tell those patients what they have and what they should receive with respect to treatment and their lifespan that is left over for them.